Well, good morning, everybody. And let me thank you for joining in this session. My name is Massimo. I'm a senior advisor on the Elimination Initiative at the Pan American Health Organization. And I will have the pleasure today to moderate this session. Session is on ending communicable diseases in the region of the Americas, accelerating the Elimination Initiative. Over the next hour and a half, we will be having an agenda to present to you and to stimulate discussion around the conceptualization and the progress of the Elimination Initiative, the vision that has grounded the initiative into the working agenda of the organization as it looks forward to work with the new administration. We will be having then a block from country experiences, and we are lucky enough to have some ministries of health highly represented on the agenda. Not all of them, unfortunately. We had to cancel at the very last minute one input from a Caribbean country. I will try to catch up with some of what the honorable ministers have presented. Then we will be hearing from one of the key strategic partners in the Elimination Initiative, and hopefully we will be having a little bit of extra time for questions and answers and fine-tune a little bit your perception and your immediate reaction to what we are going to present to you. I will go into the details of the agenda. I will rather call upon the speakers and introduce them formally when their time in the agenda comes. I apologize for the little delay. We did have a little bit of a technical problem with the uploading of the video. I hope it is under control now. Maybe we will see. Without wasting any further time, I am pleased to pass the floor to Dr. Jarbas Barbosa, the director of PAHO, who will be setting the scene and let us all understand what is the vision and the perspective behind this initiative. Dr. Barbosa, please.
Thank you, Maximo. Good morning, dear Minister Carla Visotti, dear Vice Minister Maciel, distinguished colleagues, ladies and gentlemen. It's an honor to host this event and share the perspectives from the Pan American Health Organization on the challenges and opportunities to eliminate communicable diseases in the Americas. 4 years ago, our member states set out to achieve something incredible for our region: the elimination of 30 communicable diseases by 2030. Building on our successful track record of stopping the transmission of the dangerous diseases from smallpox to polio to neonatal tetanus, this elimination initiative was designed to take an integrated and sustainable approach to protecting our population from the preventable threats that remain. Threats like cholera, cervical cancer, HIV, TB, hepatitis B and C, threats that nobody should have to fear today. That was 2019. Just a few months after the launch of this effort, COVID-19 struck our region with a force we never imagined was possible, killing nearly 3 million people across the Americas and infecting hundreds of millions more. COVID-19 was a clear reminder of just how dangerous and disruptive communicable diseases can be, not just to our health, but to our entire lives. Today, as the Americas emerge from the pandemic, it's time to relaunch the Elimination Initiative with a stronger and more mature approach, using the lessons we have learned from this pandemic. To ensure that this initiative can be successful within today's context, we are focusing on 4 fundamental building blocks. First is our past experience. The Americas have long been at the forefront of disease elimination. PAHO was formed 120 years ago to stop the spread of yellow fever, and it has since worked hand in hand with countries throughout our region to protect people from communicable disease. This has only been possible through the strong leadership of the Ministry of Health and strong support from all sectors, from health to academic to private. Combining this experience with the more recent lessons from COVID-19, like the need for closer technical collaboration with countries and more resilient health systems, and we have a wealth of knowledge to draw from as we embark on this new initiative. Second, is improving and accelerating access to life-saving health tools and innovations. PAHO's regional revolving fund are a unique procurement and supply management mechanism exclusive to PAHO's member states. They were essential to delivering vaccines and other health products to countries throughout the pandemic, mitigating the inequity we witnessed in the global vaccine rollout. Ensuring access to the range of vaccines, diagnostic medicines, and emerging technologies we have at hand will be an important factor in stopping communicable disease. Next is maintain a relentless focus on health inequity. Again, the COVID-19 pandemic illustrated several of the deep-rooted inequities in our health system at the national, regional, and global level. We must strive to improve equity so that nobody, especially our most vulnerable population, is left behind. Finally, we must leverage the Elimination initiative to make a broader impact on public health in the region. We know just how important health system resilience and pandemic preparedness are to keeping our population safe. By improving supply, delivery, and diagnostic mechanisms, the Elimination initiative will be a crucial driver for bolstering health system resilience and preparedness in the face of future pandemics. One of the most important lessons for PAHO coming out of the pandemic was that we, as an organization, had to work to do, especially if we wanted to lead the way toward the end this decade. To better position PAHO to achieve this goal, we are taking steps to improve our processes, strengthen our capacities, and become fit for the challenge that lie ahead. For example, we have launched a new department dedicated to social and environmental determinants for health equity, helping us to recognize and address the social and environmental factors that drive inequity and negatively impact health. Another new department focused on innovation, access to medicines and health technology is designed to accelerate the introduction of new medicines, diagnostics, and other tools in support of elimination efforts, in particular at the point of care. And the Department of Health System and Services has refocused its attention on primary health care and the quest for resilient and sustainable health systems. Strategic position of the comprehensive immunization program under the direct supervision of the Assistant Director allow the organization to increase the visibility of the immunization program and facilitate the coordination with the departments and country offices to recover and improve routine vaccination coverage. When I assumed the role of PAHO Director earlier this year, I made a commitment to pursue 5 priorities to help us advance toward universal health in the Americas. A relentless focus on stopping communicable diseases was one of them. I firmly believe that the region of the Americas is in a unique position to lead the charge in eliminating communicable diseases. Together, we can transform decades of dedication and investment in disease control programs into a new chapter of achievement. The word here is together. Success hinges on our capacity to foster strong collaboration across programs and sectors, as well as our dedication to supporting cross-cutting measures. We must share an unwavering commitment to addressing health inequities and directing our efforts toward the most vulnerable population. During today's session, we will hear more about how the region is already reshaping its public health landscape. I extend a warm welcome and heartfelt gratitude to the Honorable Minister of Argentina, Dr. Carlos Vizot, the Vice Minister of Brazil, Dr. Etel Maciel, for their exemplary leadership and for generously sharing their invaluable perspectives and experiences with us. Furthermore, I would also like to extend my gratitude to Philip Dunnington, the Executive Director of UNITAID, for his presence here today. UNITAID is a key partner who is actively collaborating with PAHO to achieve our goals of disease elimination. Finally, I want to thank all of you for being here with us today. I am confident this session will not only inspire, but also invigorate us as we embark on this transformative path together. Thank you.
Thank you very much, Dr. Barbosa, for your words. I was told that we have positively fixed the little glitch with a video song. In addition to the words of Dr. Barbosa, let's have a visual representation of what the elimination.
There's so much to see. There's so much to see. So much work has already been done. Building momentum to create more of this quality of life. Less communicable diseases. More people have the chance to build better, healthier, safer lives. But the momentum cannot stop here. The COVID-19 pandemic has shown us that as long as communicable diseases continue to spread, the quality of our lives is at stake. We are all at risk until everyone is safe. That's why PAHO's Elimination Initiative has set its sights on eliminating more than 30 communicable diseases and related conditions by 2030. To achieve this, we must ensure everyone in the Americas has access to vaccinations, quality health care that includes timely diagnosis and treatment, as well as water, sanitation, and hygiene facilities. This is not a dream. It's a right and everyone's responsibility. We should all have an equal opportunity to enjoy healthy, impactful lives. There's so much more to see here. So let's work together for a disease-free future.
Well, the powerful aspirational messages. Let's step back now and listen from Dr. Silvana Bighieri, Director of the Department of Communicable Diseases Prevention, Control, and Elimination, to see where we come from and what are the steps forward and the progress in the long path to the elimination of communicable diseases. Silvana.
Thank you, Massimo, Honorable Minister, Honorable Vice Minister, Dr. Barbosa, colleagues. My objective this morning is to try to illustrate the words of Dr. Barbosa with some key facts and examples regarding the progress of the disease elimination initiative in the Americas. Yeah, the next one, please. So this picture from 1902 or before, it's a good illustration that disease elimination is in the DNA of the Pan American Health Organization. We were talking about malaria and yellow fever in all the American intertropical areas of the Americas and beyond. So this is what we intend to do, is to again put the Pan Americanism at the service of disease elimination. The next one, please. And also, you can see in this timeline the progress of elimination of some key diseases in this region until the day of today, starting with immunopreventable diseases in the region of the Americas, of course, not in this continent, we are in Europe now, starting with the polio in the region of the Americas, but also I'd like to flag the mother-to-child elimination of HIV and syphilis in Cuba first, and in most of the countries of the Eastern Caribbean at the moment. And some very, very interesting progress in malaria elimination. Paraguay, Argentina, El Salvador, Belize, and we have new goals in our as objective in the coming years. We'll see this later. The next one, please. So before the pandemic, And as Dr. Barros has said, the pandemic is the center of our concerns because it had a huge impact on our societies in the Americas. Before the pandemic, an elimination initiative framework was endorsed unanimously by all the countries of the Americas with 4 lines of actions. And I'd like to flag some of the actions: strengthening the integration of health system and service delivery, strengthening health surveillance, including with digital health, and addressing environmental and social determinants of health, and also strengthening governance. Regarding social determinants of health, I'd like to highlight the importance of indigenous health in the region of the Americas. We are not going to succeed if we don't deal with population in situation of vulnerability, including indigenous people and Afro-descendant minorities in our region. The next slide, please. So an illustration of the impact of COVID from the left to the right. Life expectancy at birth in the Americas dropped during the pandemic. We have this, you can see, but it's like an epic curve. We have a GDP growth rate increasing during and following the pandemic. And we have a very severe disruption in key service delivery, including immunization services, including the coverage of immunization. You can see the red bar on the right-hand side of this slide. The next one, please. It's why in 2022, it was key for an American Health Organization to relaunch the disease elimination initiative on new grounds, on new pillars. And first with the landscape, with a publication in the Lancet, and through the assistance of the Strategic Technical Advisory Group, with new recommendations regarding implementation, monitoring, evaluation, integration in primary health care, and community engagement and partnerships. The next one, please. So we have this list of disease updated candidates for elimination by 2030, and we can do it. Many of the diseases, we can do it in some countries, in multi-countries approach, we can do it before this date. And some of the objectives are adopted from global objectives. I'm thinking about ending yellow fever epidemics, for example, which is very feasible in the Americas, and which is on its good way at the moment. The next slide, please. I mentioned a couple of times the integrated services, integration into primary healthcare, and integration into health systems. We have toolkits sharing the best published conceptual frameworks. And of course, we have the 3 I's, investments, innovation, and implementation. The next one, please. So I'd like to spend some time on promising experiences on integration of disease elimination into existing programs and structures. The Mother to Child Transmission Plus initiative closely linked to antenatal care and mother and child health platforms is key. We are talking about HIV, we are talking about syphilis, we are talking about hepatitis, and we are talking about Chagas disease. And there are some innovation I'd like to highlight regarding adoption and scale of rapid testing. In all this initiative, the laboratory component is really crucial, is key. We have to work on integration and expansion of laboratory platforms from rapid testing at primary healthcare level to reference laboratories. I'd like also to flag some progress and interesting initiatives going on for 15 years plus. For example, the integration of the deworming campaigns during the immunization campaign in countries. So it gives a window of opportunity to catch kids when they are ready for receiving the regimen for vaccination. And you can do the deworming, and you can do a boost coverage in some countries up to twice a year. So it's linked also to the integration into the health in school programs. The next one, please. Dr. Guidinelli, I assume, will expand regarding cervical cancer. Unfortunately, Mr. Joseph from Antigua and Barbuda has been unable to travel to Berlin at this moment, but the HPV, the cervical cancer integrated approach with HPV vaccine integrated into routine childhood vaccines and linked to sexual and reproductive health and school-based vaccination and laboratory access for screening for cancer. We have good results in some countries, including Caribbean countries at the moment. And I think that we think that we have the tools to be used by all other countries in the Americas for this. We have also very interesting progress regarding viral hepatitis with integration with HIV, STI, TB, and chronic diseases, and of course, with primary health care, with a micro-elimination strategy targeting population groups with higher burden, and of course, depending if it's hepatitis B or hepatitis C, we may have some fine-tuning and differences, but the importance is really to target the population more at risk for these diseases. The next one, please. And of course, we have this aspect which is really transversal of innovation in terms of service delivery models, in innovation in terms of information systems and surveillance. I like to highlight the digital health initiative that we have at regional level, integration and modernized laboratory services. I'm repeating myself, but laboratory strengthening is at the core, the center of our initiative and closely linked to surveillance. And of course, regional and local manufacturing. And I will like this later in the presentation. Candidates for the elimination, some key example, elimination of mother to child transmission of HIV. 8 countries and territories to date regarding this, and with some interesting lessons learned. It must be inter-programmatic, high-level political commitment and the marker of quality of maternal and child health. And you can see on the right-hand side, the estimated HIV therapy among pregnant women, which ticked close to 80% of pregnant women HIV positive receiving an effective regimen during the period 2010-2020. Next slide, please. And also linked to one of my previous comments, the HPV vaccination coverage by the age of 15 in the region of the Americas, with a goal of 90% of girls, 90 of girls fully vaccinated with the HPV vaccine before the age of 15. And of course, the second part of the strategy, which is also immunizing boys that are also identified during the same age group, the same period in a school age context. The next one, please. And candidate for elimination, I mentioned in the chronology and the timeline, the successful elimination in Paraguay, Argentina, El Salvador, and Belize. You may see on this epi curve on the bottom part of the slide, some big peak around 2017-18. This is one country in the Americas, this is Venezuela. This was the humanitarian crisis in Venezuela with the migration of people, Warao people crossing the border through to Brazil, for example, but there were many other aspects. And you can see even if it's a limited reduction in terms of incidence of cases, you can see a 45% reduction during the period 2015-2022 of death by malaria. We are talking of Madame Patsiparon in this case, which still represent 25-26% of the cases of malaria in the intertropical region of the Americas. The next slide, please. So what we have in front of us, the roadmap to 2030, we have countries committed to do elimination of key diseases. We are talking about, again, mother-to-child transmission of HIV and syphilis, lymphatic filariasis, trachoma, schistosomiasis, and malaria in countries. Our next one for malaria is Suriname 2025. This is feasible. This is a couple of years now that we don't have any autochthonous cases in Suriname. But of course, we have to see it as in a multi-country, sub-regional approach. The Guyanese Shield, which is big, from the Bolivar state of Venezuela to the state of Amapá in Brazil, including also Guyana and French Guiana. So this is a nice challenge, but Suriname can do it definitely, and with the support and assistance from neighboring countries. The next one, please. And something that is also transversal to the initiative is the focus on equity, social determinants, and environmental risk. This is a very busy slide. I'd like to, again, to flag two components, two aspects of this slide. The first aspect is indigenous health, intercultural approaches through knowledge dialogues. And when I say indigenous, I include also Afro-descended minorities in countries of the Americas. And the second aspect I'd like to flag is climate change. We have to be prepared for an impact of climate change on some of the diseases that are targets of elimination. One of the examples, it's not the only one in the list of diseases that we have, it's malaria. With climate change, the malaria dynamics may change in some countries, in some subregions, which are targeting elimination. I'm thinking about Central America, but I'm thinking also about the Guyanese Shield that I mentioned previously. And of course, the vaccine with impact on the competency of the different actors that we have in the Amazon basin. I have 2 minutes left, so I try to be quick. The next slide, please. The 2 minutes is about what specific mechanisms and special assets that we have in the Americas. We have the PAO regional revolving funds for vaccines, medicines, and health technologies. So it means that our countries can access this mechanism. They can do, they can save money, they can do naked economy of scale, and they can get quicker and plan better the access to technologies, including, again, I'm using this as a transversal comment, for example, rapid diagnostic tests to serve at community level. The next one, please. So the two funds, the revolving funds at PAO, are more than 20 years running and serving the countries. It's cost effective, for example, for hepatitis and HIV, for medications that are to acquire as malaria, for the small markets. We're thinking about Caribbean, small Caribbean island population, but also strategic supplies for Chagas, for malaria, emergency stock of antiretroviral, HIV diagnostic, TB, and it's a potential long-term saving that would allow us to recover some coverage, including the immunization program, and to participate to the prevention of response to environment. The next slide, please. The last example regarding Hep C, treatment and test price decrease. Test for Hep C, $1, and you can see the evolution from 2015 to now of the cost of sofosbuvir. So starting with a cost of 5,400 to $72 at this moment through the funds, the PAO revolving funds, and also the decrease in the cost for fixed dose combination of WHO pre-qualified treatment from about 8,000 to $3,000, and of course we're expecting a decrease in the coming years regarding these very effective medications for eliminating Hep C. I think this was my last slide. I'd like to thank you for your attention. And give the floor back to our moderator.
Thank for so nicely unpacking all this and blaming all these arguments in describing a little bit what makes the elimination initiative of communicable diseases in the Americas a unique opportunity from the genetic imprinting of 120 years ago, sense of continuity in terms of mission, but also some of the key opportunities. You rightly put the accent on the revolving fund, because those are mechanisms that are unique to the region of the Americas, but also unique are some of the strategies that countries are implementing. And I'm pleased to introduce the next speaker, Dr. Etienne Maciel, Vice Minister, actually Secretary for Surveillance and Environment in the Ministry of Health of Brazil. And she will be presenting a very interesting approach in terms of playing with social determinants through an intersectoral approach towards elimination of diseases.
Thank you
Welcome,
very much.
please.
Thank you very much. I'd like to thank you, Dr. Jarvis, for the invitation to be here and to say very welcome to my colleague, Dr. Carlos Zotti, Minister of Argentina, and Dr. Silvani. Congratulations for the new position and hope work together to build this elimination in all our region. So I will talk a little bit about our initiative in Brazil. Brazil is under new government. We elected a new president, President Lula, and after almost 6 years of nothing that was done in working the SDGs and the elimination of disease in Brazil. We are back talking about this. And when we are under this new position in the Secretary of Health, we came out with a plan to the Minister of Health, Dr. Nizia Trindade, that went to the President Lula. And next slide, please. And the President Lula signed this decree that put 9 ministers in Brazil working together in this initiative. Because first of all, we are not eliminating any disease only with the health sector. This is the problem in all this disease, especially because they have a very strong relation with poverty. So we need to work with the Minister of Racial Equality, the Minister of Integration, Regional Integration in Brazil, the Social Development, Justice, because some of these diseases, they are very disproportionate in the prisons in Brazil. So we need this, and I don't know in other countries, but in Brazil we have very difficult to come out with the data from the health justice system, because as they have private information, share this information, it's very difficult even in the same government. So, and as this person, these people, they are usually transferred from one prison to other. We usually lost this information from the health system point of view. So to have the information from the Minister of Justice, it's very important to us, and it's very complicated to have this information shared with us. So with this decree, the President Lula say that we need to work together in the same room with this disease. So this is the plan that we work since last April, and the Minister of Health coordinated this initiative, and it's not easy, and I can tell you it's very hard to work, even in the Minister of Health with a lot of different departments. It's not easy to work together. I think in our history, we used to work everyone in your box. And make this relationship be, outside the box, it's complicated. It's a learning process. So next slide, please. So we are looking for the SDG 3, and but looking what we can do in Brazil. We are not eliminating all the disease, but we have a plan for what we can do in this disease that we can work, especially HIV, tuberculosis, malaria, and other neglected disease that I will show. Next slide, please. So the goal is promote these intersectoral actions and working together to eliminate this, especially because some of disease we need to we need to build house for these people that live in streets, in shelters. So it's a complicated process that we are working. And as the President Lula put the fight against poverty as the priority, top one priority in Brazil, this came out with opportunity to us to eliminate this disease. Next slide, please. So what disease we are talking about? We are not saying about eradicate disease. It's like a dream for someone, but eliminate as a health problem some disease, and looking for operational target for other disease. So it's what we are looking in this plan. So eliminate as a public health problem, we are looking malaria, trachoma, onchocercosis, schistosomiasis, geomyositis, lymphatic filariasis, and Chagas disease, and vertical transmission, Chagas disease, syphilis. It is a huge problem in Brazil in the last 4 years. The numbers are terrible. Hepatitis B, HIV, and HLV. And for the operational targets, we are looking for the decrease the incidence of tuberculosis, cancer disease, hepatitis, and HIV, which is the target for WHO that we are looking for. Next slide, please. When I'm talking Brazil has 5,570 municipalities, so a lot of municipalities. But they are, when we are talking about this disease, they are comprising almost 175 municipalities. So it's not like impossible. We can do this if you look where this disease are the real problem. So some municipalities, they're comprising the same disease, one of them. So in this color, we see which of them they are looking for this social determinant disease. And there's some municipalities that we have like all 7 this disease. And I pick up only malaria as an example. In this 5,507 municipalities, only 30 municipalities has 8% of malaria cases. So if you focus in these 30 municipalities, it's not so hard talking in eliminate. So this is our plan and what we are doing right now. We work with this 9 ministers in the President Lula government. And right now, for our lucky, there is other ministers that want to be part of this initiative. And we have the minister of the woman and other minister that was not in the first plan, but they want to work with us. So we are doing some meetings. We are working in the municipalities with the task force in the territory to work to them to build this the capacity building in this municipality to go this and to make this elimination. Next slide, please. And this is my last slide. And before I'm going to this, I'll talk about a very important thing about funding, because you cannot do any of this without funding. And this new rule of government, the president put almost $1 billion to work with this initiative. We are building all the diagnostic system in Brazil. We are building new labs in region that we don't have yet. We have some empty space in Brazil, especially in the Amazon region. So we are looking for this. We will building some I don't know in English how to say modern mobile labs, because in some Amazonian region, we cannot build in the territory, we need to go there because there's the forest, we cannot, the deforestation, and we have this very important problem, but we are doing this right now. And we call, the plan is under the PAC, which is the Accelerate Plan for Brazil. And with this PAC, we have building this infrastructure and embrace some programs with Fiocruz that Mario is here, and we looking very hard to work together with USP, that we have another colleague here, Nelson, and because right now, Sylvain, climate change is a very important problem, because when we did this plan in March and present to the president in April, we didn't know what was happening in Brazil, and right now Brazil is striking very hard with climate change, and we have some regions in the south part of Brazil that was under water, very atypical, if I could say that. We don't know how atypical it will be in the next years, but we have this El Niño, and this make a lot of problem, and we have a whole community under the water. And in the other side, in the north part of Brazil, in the Amazon region, we have extremely dry. So we don't know what will come before this. So right now we are in like an alert state, because everything changed and changed very fast. And now we are including new technologies. We just incorporate the tafenoquine for the treatment of malaria, and some the other vaccines that we are working together, and vaccines. We are combating the stigma that was very important problem right now in Brazil. After 4 years that we didn't talk about any transmissible disease, any education about sexuality, especially for young adolescents. And this topic was like a prohibited topic in Brazil, so we have a lot of problem with this right now. Last week, our Congress voted for a law that prohibited the homoafective marriage. That was for our STF, the Supreme Court. The English words come up. So the Supreme Court is already advocate for this, but the Congress right now came out with this because it's a topic in Brazil that is very problematic right now. And this is unfortunately work against us, because we have until last year a very important advocate against HPV vaccine in Brazil because of this. because some people, some family thinks that if you give the vaccine, you are stimulate the sexual early initiate in this adolescent. So we are working with this in Brazil right now, and these are very important for our policy. Unfortunately, we are expand access to prevent, to diagnosis, and especially for this imprisoned people under this Minister of Justice working together with us. We are joint promotion to promote sexual and reproductive health education, which is very problematic topic right now in Brazil. And reduce inequities and expand social assistance for vulnerable population. We had a very important program in Brazil that called Bolsa Família, that was not interrupted, but has some discontinuation in some program, and one of them is that to receive these benefits, we should like put your children under education, you have to vaccinate your children, and this was taken out for the last government. So right now we are putting these conditionalities again, and it's a hard work to educate people to do this again. And under this program that President Lula has, there's a popular housing that's giving housing for people. And right now in this new program, people that is under this Bolsa Família program, they didn't pay nothing in the last program. Even for the President Lula, they pay a little, but they pay. Right now they didn't pay. And we are expand access to early diagnosis and timely treatment, especially for indigenous people, because when you're looking even in Brazil, when you're looking in the profile for the epidemiology in these indigenous people and non-indigenous people, is that we are like in 21st century and they are in 20th century. It's like the indigenous people in Brazil profile health is like if they were on 70s in Brazil in the last century. So this is a very important and hard work that we need to do to bring this day together in the same center is for the time of diagnosis and treatment for them. So I think it's my last one. Thank you very much.
Thank you very much, Dr. Marcel, for sharing this ambitious, forward-looking agenda, but with such a powerful political commitment, leadership from the Ministry of Health, participation from other line ministries, involvement of civil society, and last but not least, investment.
Yes.
All seems to be converging in the right direction, so we're very proud to be intimately associated with Brazil in this undertaking. Thank you.
Thank you.
It's now my pleasure to introduce the next speaker, Dr. Carla Rizzotti, the Honorable Minister of Health in Argentina, who will be sharing from a completely different perspective a very practical experience that the country is pursuing in the elimination of hepatitis C through a micro-elimination approach. Please.
Thank you, Massimo. Good morning, Sarah, Peter, Divine. Thank you for the invitation. I really want to celebrate this initiative. It's really, really important. We have the tools to eliminate these transmissible communicable diseases, and we must do it. In Argentina, from COVID, we went through an outbreak of the pulmonary hepatitis of unknown origin, monkeypox, dengue, avian flu. We have an outbreak of salmonella, legionella, and then dengue again, and then respiratory diseases, syncytial respiratory virus in newborns. I think that this comprehensive approach is absolutely important. thinking about life core, thinking about climate change, thinking about social determinants. It's absolutely necessary to work on that. So Argentina is really committed with the PACO and World Health Organization strategies. And in specifically regarding microelimination, we can move to the next slide. We have a huge work done, just few slides to know some numbers from Argentina. These are the goals. 2030, the pandemic, COVID-19 pandemic, the negative impact in all of our goals, not only health and sanitary goals, but also in other areas of the government. Let me say one thing before about the initiative in Brazil. In Argentina, we have 3 transversal cabinets that are in the level of the chief of cabinet, and one is gender, one is mental health, and the other is climate change. So there are 3 national cabinets that focus and work with all the ministries of the government regarding the transversalization of some policies. And we are working on having an initiative like Brazil with in combination with PACO's initiative. I think that without a transversalization of the policies, without other ministries, it's not possible from the health sector only work on that. I was talking with Bruce that we had the first meeting together with the Minister of Health and Environment and Climate Change of all the 24 provinces regarding the plans and regarding this comprehensive approach, because now we know it's not enough with the tools that we have. So focusing again in hepatitis, the next please. This also has been said regarding the plan. How can we, when we talk about eliminating hepatitis, we are talking about treatment, we are talking about tests, of course, environment, investment, not environment, the strategies, the information systems, and the simplified care. We have to work in the primary care system, and we also have to work with innovation and access, as has been told. The next, we have bulletin. How do you say bulletin? It's a bulletin. I was thinking about the word in English. We have been working on that. The next, please. If you see in the last 2 years, we have an increase of diagnosis. We have been working on the access of testing. So I think that this can be one of the reasons we have been going in territory. Also, we have some trucks that are calling STAR, which is being there, is to be where you are. It's a sanitary territorial strategy in Argentina, going with trucks to the communities that are not that has not access to health and to test and treat and vaccinate. And this is these are the 5 regions of Argentina, and the pink is the whole country. So we have really found the people who need treatment. The next, please. And this situation, the distribution by age groups is higher between 40 and 59, and it's also more common in men. And you can see in the first slide, the graphic, the green is men, and the highest line in the one in down is the younger persons. The next. We also have made some studies of prevalence regarding hepatitis in blood banks, and we have, from the last 10 years, we have a reduction in 32% in hepatitis C antibodies. In the prevalence of hepatitis C antibodies is the last line. The total is 0.32, and we started 0.42. And also we have a decrease in the mortality that is going to be shown later. The next, please. This information is regarding the liver transplant we're performing in the country. We have 50% of reduction in hepatitis C as cause of liver transplantation. The pink is hepatitis C and the light blue is hepatitis B in Argentina. We also have universal vaccination against hepatitis B. And regarding hepatitis A, we had no liver transplant in vaccinated children since 2007, also due to the vaccination strategy in our country. The next, and this is the proportion of liver transplant due to hepatitis in Argentina, and it also has a tendency of declining regarding the cause of liver transplantation. We have a decrease in the registered liver transplantation regarding hepatitis C. In the next. And this is, I think, the most important is regarding mortality. We had a reduction in mortality of hepatitis C since 2015, when we started the treatments and the access for treatments in against hepatitis C and hepatitis B. The next. And as Brazil was back last year or this year, Argentina came back in 2019. We have also a very negative impact in health. And when we arrived to the government in 2019, we had 400 people waiting for the treatment in hepatitis C, and we worked really hard regarding the test and the access, and we got the treatments, and we start working on the access. We really purchased the medication. We work with the simplification of the diagnosis, and between 2020 till now, we work also with the access of pan-genotypic HCV treatment. We purchase rapid tests. We arrived to a new law, a very comprehensive law regarding HIV, hepatitis, viral hepatitis, sexual transmitted diseases, TB, and we also include lepra in this strategy, and it's a law which is based on human rights, it's gender equity and social determinants, and also regarding access and regarding innovation. We work with the Intensive Care Society, and Incucay is our transplant institution regarding the HCV and donor program. We work with the provinces, as we are a federal country also, regarding microelimination in dialysis centers and also in prisons. We work with not yet. We work with all the health sectors, not only in the public sector. We work with the private sector and with the social security sector also. And we work with scientific societies regarding diagnostic treatment guides, universal testing, and also we really train all the professionals and the health team all around the country. And also we work in the primary health, in the primary care level, because this is the main challenge to improve access, absolutely. And then we went through the new antivirals. And then yes. And we have these two initiatives. We work with the dialysis in centers in Argentina and with the prisons also. And the next. And regarding dialysis, it also was very important during pandemic. Dialysis, renal chronic disease was one of the main targets. So we worked really hard regarding the access of vaccination and this access and contact with nephrologists as a comprehensive and multisectoral approach. This is the National Registry of Chronic Dialysis, and it comes from 2004 to 2021, and we can see also a decrease of almost 12% of the presence of antibodies against hepatitis C, the prevalence and the lines that are mainly the blue line, the squares, the little squares are the percentage of HIV, pardon, the HCV positive is the blue little square. The green circles are S antigen, and the triangles are HIV antibodies. The next. And regarding the prevalence in this register, we also see the HCV positive is also a decrease of 3%, and it's the same blue line. The next. We really work on them with them. We work with the coordination of hepatitis, viral hepatitis. We also, when we arrive to the government, we create a national direction of communicable diseases, just to work in a comprehensive approach and not to be in different boxes. As Edel said, not only the hepatitis, but also, of course, HIV, TBC, lepra, and all the approach. We work on that. Then we really went through the genotypification, and then the analysis of the stratification of the disease, just to make the indication for the treatment, and then work with the social security. Well, we have, as I said, we have 400 people in waiting for the treatment, because the social security and the private sector didn't supply the treatment. So we went through the social security, and if they did not supply, we did that. If they went 3 months without a coverage, or it was rejected, we work with the Ministry of Health, and they ask the treatment for the Ministry of Health, and we really work on that. So we work with co-infections also, and of course pregnancy. And we delivered 93 treatments with only in the dialysis centers, and 98% of people were cured through this strategy of improving the access, and to improving the circuits, because it's all about circuits and miscommunication and missed opportunities. The next, please. And regarding the prisons, the next, we work. We have two system of penitentiary service. We have the federal, the national prisons, and we have the provincial penitentiary service. So we have in 2017, we have the prevalence of hepatitis C was 3.3%, and regarding our surveillance data and the information analyzed by the Ministry of Health, we are around the 0.5 in the penitentiary service. The next. And here we have the people deprived of liberty in different establishments, more than 11,000. But in one penitentiary complex, we have 1,000, almost 1,907 modules, and we have a special program which is called Health in Program in Confined Environments. We have been working also in training sanitary agencies in prisons also, and we went through the training working with pre-test and post-test advice. And if you can see all of the population, we could test almost 1,300, and we have 76% of acceptability for the test, and 17 were positive. The next. This is in the women unit in Ezeiza also. We have almost 500 people, and the percentage of acceptability was 7%, pre-positive. The prevalence was less than 1%. The next one. And this is the summary of this strategy. From all the modules, 20 were positive. The prevalence was 1.2%, and we have the confirmed diagnosis in 14 people, and they went through the treatment. The next. We are working also with the jurisdictional programs. They are working with us just to reproduce the strategy in the rest of the provinces. There are 3 provinces, Catamarca, San Juan, and Tucumán, that are working on their provincial prisons. On the next. And this is the strategy and the summary of our strategy. We, as I said, we need not only the political decision, we need to move beyond ministries of health. We need the presidential decision and the Ministry of Economy and all the support of all the other ministries of the cabinet, and we need to invest on that. But the most important is that political decision and investments are not going to be accessed if we don't work together with the territories, and also with the social determinants and the civil society and the scientific society, and the stigma and discrimination and in all the environment. So it's a very complex, it's more easy to do it because we have the tool and we know how to diagnose and how to treat, but to turn into a reality and to turn in a real access is the main challenge. So this is the Argentina's experience, and we are happy to share it with you and to be in this important event. Thank you.
Thank you very much, Honorable Minister, for sharing this seemingly linear and simple strategy that we have been all into the complexity of the systems and the necessity to maintain such a strong leadership. Let me remind that hepatitis C is today the only chronic viral infection for which we have a cure. We have seen how prices drop to a level which is probably affordable to the large majority of member states and perhaps even individuals, but still some of the complexities have put up barriers that make it really difficult. Lots of lessons to be learned and to be shared, so we will continue our partnership in that direction. And now let me move, as I mentioned earlier, the Honorable Minister of Health of Antigua and Barbuda had to drop from the program at the very last minute, but we felt it important to share some of its key messages because they come from a very powerful region in the Americas, the Caribbean. Although small and certainly not comparable to giant countries like Brazil and Argentina, the Caribbean has been extremely vocal and successful in its incidence in the setting up of even global health agendas. Let me remind the NCD chapter, which was initiated by the Caribbean with a high-level meeting in New York at the United Nations a few years ago. And let me also say how ENTCT, Sylvain mentioned the many achievements in the region in eliminating mother-to-child transmission of HIV and syphilis, and that for the time being is still all about the Caribbean. Antigua and Barbuda is one of the countries that in 2017 were validated by WHO and us, PAHO, for reaching the targets of both HIV and syphilis mother-to-child transmission, and they have been revalidated in the last couple of years as they keep maintaining that goal alive. So I'm sure the minister would have said it much more eloquently than I can do, but the message is clear. Cervical cancer is the second most common cancer in women in this country, and it is the third leading cause of early mortality in the population. He was adamant in saying that they have taken the decision to set up a national task force for the elimination of cervical cancer. And the main task of this task force is to implement the WHO strategy for the elimination of cancer, cervical cancer. That implies achieving targets of 90% vaccination coverage among girls aged 15. They expanded the target to not only vaccinate girls, but also adolescent boys. There are additional benefits by doing so. Second target is 70% of women aged 35 and then 45 being tested with a highly performing molecular diagnosis test. And the third is 90% of women with symptoms of hopefully early symptoms of cervical cancer or lesions that could eventually lead to the disease, be treated and be provided all necessary cure and treatment assistance. They are moving forward in that. Their targets, their results are moving towards the desired targets. And so we wish really the Caribbean as a whole and Antigua and Barbuda in the specific all success. We all know how important it is to have a champion country in that part of the world. We have seen it in EMTCT, beginning with Cuba and then other Caribbean countries following suit. The same example, and we are confident that the strong positioning, the political leadership of the Minister of Health in Antigua and Barbuda will pave the way for more countries in the Caribbean region to go along the same direction and eliminate cervical cancer. I hope the minister will be satisfied and happy with my short summary. And it's now taking me to the last but not least important speaker of the day, because we have one of the key strategic partners with us, and we're very thankful to UNITAID and Dr. Philippe Dunepont for being with us. I'm sure he will unpack his views and his focus on innovation as a key driver and a great opportunity in achieving the elimination goals. Dr. Dunepont, you have the floor, please.
Thank you so much for the invitation, and Minister, Secretary of State, and Dr. Barbosa, Director Barbosa, and colleagues. I'm very glad to be with you after the session we had in Washington a couple of weeks ago. I have to confess that what I like my job is that I'm learning every day. And one of my learning was Dr. Barbosa, who told me in New York that in fact, and now it's mine, but I'm not an optimist. I'm not a pessimist. I'm a realistic. I'm a realist with hope. And it's coming from a writer from Brazil, Ariano Sassuina. And I think that it's exactly how we should stand in front of the crisis of the world, but also in front of the challenge of elimination. The second point I want to make is that there are three, maybe to put it a little bit negatively, but mistakes that we are doing all the time in public health. One is to underestimate the power of innovation. To do a lot of what we discussed to present today, you need tests, affordable of product as a cure, like you need coordination. But the second mistake we are doing is not to listen to the people and their needs. I have many examples of that, where when you listen to people, for example, you can explore auto tests of the liver. Then you have a solution that you never, and you have a traction. So how to use the product is as much as important as the product itself. In particular, you know, health is a sector where, at the difference of when you take a Uber or go to an hotel or go to a plane, in that situation, you receive an email 2 hours after saying, what was your service, how we can improve, You have zero mileage. So again, by proxy, when you listen to people, you find solution. The last mistake we are doing a lot collectively, and we need to fight, is the fact that there is a confusion between poor people and the fact that they cannot make rational choice, which is absolutely false. Poor people are making rational choice, in particular health, when they have the opportunity to take something that works for them and it's affordable, believe me, they will take it all the time. And I have multiple examples, in fact, through what you presented, it's a confirmation. So you can turn it into positive. The third introductory remark that on the free slide after that is the fact that to do anything in health, but in particular for elimination, it's the political will and the leadership. And I think that I'm really encouraged and pleased to work with you all and Apple, because I think that vision, that political commitment at the highest level, with the president, with Lula, with the minister, in Argentina, and the minister we saw in Washington, frankly, it's really, it's really what will make a difference. And we need, as a technical agency, that political space to do the work that we need to do, and we know very well the Brazil is at our door. The first slide is to just illustrate what I was trying to say with innovation. As a United, we reach every year more than, it's a typo, 200 million people around the world, which are, it's a small number, but all of these people are quite poor and vulnerable for many reasons, you know, TB, malaria, and women and girls. The savings, frankly, it's a question of affordability, but it's around for the next year to become 8 billion. So it's not savings for us, it's savings for the response. It's a way to increase the coverage and to increase the number of people who can access to this product. And also saving time. This is the power of innovation. It's not my say, by the way, it's a calculation we made for the 3 diseases that has been published and reviewed by PER. Saving time, you accelerate the response with the type of innovation we have, by 3.5 years, which is half the time we have to conclude our elimination. Next slide, and just to say that we have been working on this, not under the elimination strategy, but still the work in HIV, including with Brazil and other countries in South America on PrEP, the work in malaria, including Dryvax, of course, the work in terms of Chagas, and the fact that we will call for a specific call of triple elimination, which is hepatitis, syphilis, and EST, is really, I mean, including cervical cancer and hepatitis C. Frankly, we have the range, and of course, the menu, if I may say, should be decided by countries. But the tools, the fact that we can work on simplify, because it's quite difficult to have the day of HIV, the day of HCV, the day of maternal health. I mean, everything in terms of, which is a reality, by the way, but everything that we can do for integration, decentralization is also something that you can have with innovation. I think I will stop there because time is running. But again, my key message is we like this agenda elimination because we believe that the region can demonstrate impact to the rest of the world. So we want to be part of this success story. It's not easy. I'm not saying it's easy. I'm just saying that given the political leadership, given the thinking, given the commitment, given the fact that we have now start to work more closely with PAO and our cousin from the Revolving Fund, for example, to share the experience and to make sure that the innovation is shared, which is, I think, an inequity that still is in the world. It's also a reason why we are so interested in engaging with you. Again, for us, it's very clear. It's something that we want to do with you, and we will be very proud to work and to achieve this goal with you. Thank you.
Thank you very much, Philippe, for sharing the wisdom of Unipay with all of us and for your very clear, powerful messages about innovation. I think it's comforting to have the backup of a global agency in such a challenging agenda. Let's be realistic. This is a highly challenging agenda, but at the same time, we seem to have not all, but most of the necessary ingredients to make it happen. And thanks also to the organizer for allowing us an extra 10-15 minutes. It would have been bad to finish off the session without hearing your immediate reactions, your comments, if you have any burning question, whatever you feel like, please feel free. We do have a few more minutes left to generate a little bit of a debate and discussion. Kindly self-introduce yourself and the organization you are representing as you speak. Thank you. Please.
Okay, thanks. Mario Moreira, President of the Oswaldo Cruz Foundation. I decided to speak because your provocation points that you brought for us about innovation. Fiocruz itself is involved, is engaged in different programs related with different organizations, international organizations, and also with PAR, with WTO. I can mention here GAP, UNITAID, STEP, DNDI, PEC, everybody sharing common objectives. So the first comment that I have to bring is the needs to articulate better this whole set of initiatives. It's very important. I can see that if we work together, we could produce much more results in the basis of the rational decision and rational allocation of resources. But the second one, it's important to us as Fiocruz, as a pharmaceutical institution as well, but we should look for a way to connect this initiative to local production initiatives. The power of procurement of the Barro Revolving Fund, it's amazing. It could develop an industry articulated with this problem that I mentioned here, to have some kind of autonomy of the region to produce itself the products. I mean, diagnostic, vaccines, and so on. We could strengthen the local industry to guarantee success in this side of the problem. Thanks.
Thank you very much, Dr. Moreira. Other comments or? Please.
Hello, good morning. I'm Luiz Oliveira from Fiocruz Brazil. First, I would like to thank the invitation and the panelists for speeches and to sharing experiences. I have some questions. I have many questions. Due to time, I will make few ones. To Sylvain, at first, climate change is extremely complex with a high impact on human health, the planet, our survival, but also economy. And so, of course, it depends on political will to really make something against that. And we passed the right time, in fact. So we are running against the clock. Very recently, we made recommendations about heat waves. There are many questions, for example, in the health service, in local health service, what to do, at which temperature do we have to talk to our population, what to do, how to act. So, which recommendations does PAGO can give us to our countries about that over health and how to fight against this do-it, health and economics. Yeah, it's a special problem in Brazil. Second, to Dr. Maciel, our secretary, and Dr. Mizotti, first wonderful programs. You were talking about vulnerable populations, imprisoned populations. Of course, it's a high-risk category. And but I would like to know about the harm reduction programs, which are the proposals for drug addicts. So, for example, they are one of the highest risk categories for STDs and TBs as well. And are they included somehow in your programs? Because of course, within prison, it's easier to work with drug addicts. They are hard to reach populations. So, which are the plans from our government? Because somehow they are reservoirs for all these diseases, especially HIV and hepatitis, due to the high risk behaviors. So, thank you very much.
Thank you very much. two sets of questions. I'll go ladies first. So I don't know which one. I don't know you. Question is like,
We have, thank you for the question. I wrote also, they are not vulnerable population, they are in situation of vulnerability, that they are not vulnerable. I think that this is very important because we make them vulnerable, the situation. So, and I also like what you said that when you explain to them and when you provide a solution, of course they want, but we have to ask them what you need, not give them what we think they need. And this is a very important change of view that point. In Argentina, we have, talking about different boxes, we have a secretary for addictions that is in the chief of cabinet also. We are working together and we have a very integral mental law, mental health law that says that we have to invest 10 points of the budget from health. And this is the first time since 2010 that the national state is investing 10 points of the health budget in mental health, and that includes problematic consumes. But people with problematic consumes are vulnerable regarding communicable diseases. We are working in the general strategies from the Minister of Health, from the health center, and from the primary care, and from the territory initiative that goes to the territory. There's one that is, I think, very interesting, and we have talked with the team in Pajo that is called Casa Mas Antonio. They are a civil society that's working with us, and we are going to make it a declaration of interest, just to spread and to make it more not only so local, and it's based on common sense that should be centered on people, on the person. They should be centered on the person, what they need. People who is in under problematic consumes, they have more risk of having HIV, TBC, hepatitis C, even to go to prison. And there is a group that goes and provides them what they need. They have direct observed treatment. They also work with the problematic consumes, and they have an integral point of view. And we are working and also hopefully with Pajo to share this experience, this ¿cómo se dice? Dispositivo, this setup. I'm sorry. This setup also with other countries, just to scale up that initiative, but they have to have a special and more comprehensive and more, and also the healthcare workers that work in this what did you say? Okay, setup, exactly. Needs to be different. It's not the people that are in the health center that could be in this kind of therapy. So this is a very important question, because they are not a high number quantity, but they are the main burden of disease of this kind of, and a specific approach could have an important impact on that.
So as I have a lot of questions, as you so it's in Brazil right now, it's a very complex. I think the world has changed, and we are in this I would say like a umbrella with a moral agenda that is divide us between one side and another side. So in Brazil, it's very concrete this, and in the last year, the Minister of Health couldn't give like syringe for people that are addicted to drugs. They didn't give condoms. They didn't give lubrication. Lubricants. So because this is like under this umbrella, the moral agenda that we work. So we have a lot of things to do. And in Brazil, as you know, people that was addicted, we saw a growing institution under the religions movement that was receiving government money to giving these people in this institution. And we have like game cure in this institution. So we have Brazil. It's a very complicated country right now. It's not the same as it was in the millennium objective that we arrived in 2015. We will conquer the world. Right now we are completely divided, and we have, even in the new government, we have this divided country with this moral agenda that drive us in the policy. Even as we cannot do this because it's a complicated environment, and it's not easy to solve this. And I believe I myself, when I accepted this job, I thought it was much more easier than this. It was, oh my gosh, I thought, oh, after 4 years that anti-vax people will arrive there, say, now we believe in science, we are giving all the medication, all the vaccine, and everybody will be there and get your shot. It's not this. It's not happening. We are working so hard to make the curve, change the curve. Only this, it's our goal right now. So it's complicated environment. We are seeing this in other countries too. So we need to work together to better, to building a better world. But we have not any more trust between us. We are in a very, a world that is in a war, crazy and insane war. And we have another coming out. So everything is changing, and we are with this ambitious agenda, trying to eliminate disease in a very faster world right now. So it's much more complicated than it was in the past, but is the way there it is. So we have to work with this, and but we are realistic, and we hope.
Thank you very much. Second question was from Sylvain.
Yes, I will try to be short. So thank you for again putting climate change and its link to economy in the center of the table. I'm not an economist, I'm just a tropical doctor. I will use my common sense. And I will use, in addition of my common sense, the example of Brazil. So it's multi-sectorial approach, and you have this ministerial level, including decision makers in economy and in political decisions. As a tropical doctor, my answer would be focusing on modeling and forecasting. In the list of diseases that are candidates for elimination, you have at least 6 vector-borne diseases. It's clearly linked. We have a risk in terms of climate change. I will not develop more. Use one example later. We have 2 diseases clearly linked to water and sanitation, access to water and sanitation, at least trachoma and cholera. And we have also the domino effect. So impact on societies and ecosystems from climate change. It means impact also on food security and many others. So it's impact on migration, internal migration, moving from a country to another, and also poverty. So modeling and forecasting will provide us with different scenarios and will allow us to, country by country, topic by topic, to better identify contingency plans. The example that I will use is more vector-borne diseases, but we can use on waterborne and poverty-linked diseases, all our poverty-linked diseases anyway. Malaria-prone areas in the Andes, in South America, if you have climate change, you would have change in terms of vector competency and transmission at higher level than expected, so more population at risk. So countries that are not used to deal with malaria in this altitude would have to take care of and be prepared for malaria transmission at a certain altitude. So this is the example of that. Thanks a lot. Thank you for your question.
Thank you, Sylvain. Definitely challenging, but increasingly better equipped to pick up those challenges. We may perhaps have a little extra time, and I'm glad
Just,
to.
I'm Bruce Gell, Rockefeller Foundation, just a comment, I commend you on this initiative. 30 by 30 is aspirational, and that's taking on big goals is important. But I wanted to highlight innovation in another way that I heard, innovation in how you approach problems. We always think about the technology parts of it, which is obviously a critical piece of it. But this idea of bringing these different sectors together, you highlighted that, not just health and environment, Rockefeller's all over climate now, but all the other, because you're gonna solve big problems, and to take on problems that require addressing social determinants brings others together. So I think when you think about what you're doing with innovation, these are great models for policy innovation, program innovation, in addition to the technology that we need to help the people. Your video highlighted clearly who you're trying to help. Your stories today showed how you're doing it. So thank you for inviting me.
Thank you for joining us, and thanks for your nice words. So if there isn't anything or anybody else who would like to contribute, so it's our pleasure. Oh, you want it? Please go ahead.
Very briefly, Nelson Gouveia from University of São Paulo. Well, first, thanks for the comments and the programs. I welcome the eliminating from the overall compile and the country specific ones. I think they are very important. I just want to emphasize the importance of vaccines, because I think it's the most effective technology that we have in place for infectious disease. And I mean, I just heard yesterday that we have new vaccines that have been developed for diseases that are not very, how can I say? I mean, they are not very profitable for the pharmaceutical companies. So you have difficulties to develop the vaccines because of that, because the pharmaceutical companies don't want to push that forward. And then that's an issue that, I think countries like Brazil and Argentina should think how to deal with, and perhaps rely on the national or non-profit organizations that can help on this. This is the first comment, and the second is about progress assessment. I mean, I think this is a very important eliminating program, but it's important, and I might have missed it, but I wonder if there is any plans on having progress assessment over the course of this program, because I mean, having setting targets is very important, but also we need to have evaluation if the program is really achieving that target in the future.
Okay, I will try to answer your last question, thanking you for the comments and the suggestions. Certainly, there is a monitoring and evaluation chapter. We didn't have enough time to present all that. And roughly speaking, it will be a combination of monitoring progress on individual diseases, their own targets and goals, together with an overarching monitoring effort, which will be more systemic, measuring progress as a region against a set of indicators that reflect the commitment of other sectors, the engagement of systems within health systems, and by doing so, we will have a combination that will probably be in a position to answer to all your questions and report back to member states, because there's a commitment taken in 2019 to report back to member states and partner on regular basis. So it's a combination of those two tools that will provide the necessary answers. So let me thank you all again for participating in this interesting session. We hope we have conveyed the right messages, the right plan, and the right combination of perspectives. So I can only thank you once again on behalf of the Pan American Health Organization for your presence and for your contribution. Thank you very much.